Hey guys, it's Dr. Marcia from Just Move Therapy, and it's Physical Therapy Month. October is super filled to the brim on the calendar with tons of awareness month and celebrations, and among those celebrations, it is the recognition of the field of physical therapy. October is the month. So if you have no idea how a physical therapist could help you or your loved ones or your grandma or your uncle or your cousin or your babies feel better and move better, this is the video for you. Fun fact, did you know the field of physical therapy started in the 1920s with World War I? They needed somebody to help all of these wounded soldiers heal better and move better, and that's where we started. At that time, it was like a certificate. You didn't have to go to school for long. In these days, it's 7 years. I have to get my undergraduate degree and a doctorate in physical therapy. That's why I'm calling myself Dr. Marcia. Make sense? So physical therapists go to school. We take board exams. We are licensed by the state, and we are private investigators for pain. We are movement experts. We know everything about how the body moves and which part needs to move to help you feel better. And we have so many specialties. You know how there was that commercial, there's an app for that? Well, there's a physical therapist for that. You have lymphedema, do your legs swell up? Did you just recover from some sort of cancer and now you wear a sleeve all the time on your arm? There's a physical therapist for that, lymphedema specialist. Do you have a 2-year-old child who isn't quite walking yet? You know, most kids are walking by 1. There's a physical therapist for that. See a pediatric physical therapist. Are you a high-level athlete? Maybe in professional sports, or maybe doing powerlifting or something like that as a hobby, but you take it super seriously. See a sports physical therapist for your pain and problems. There's so many specialties. If you have trouble peeing on the platform or you have accidents, Pelvic Health physical therapy. The beam off fall and maybe she had a stroke, maybe there's a broken hip, there's a geriatric physical therapist. We have physical therapists in NICUs of the hospital, in inpatient rehab, in nursing homes, in daycares, everywhere. Throughout the lifespan, a physical therapist is there to help you move and groove and feel better. We are it, okay? And I know that there are barriers. Some people are cash-based, so that's pretty simple. You have the money, then you see them. But some people are insurance-based, and maybe you don't even have insurance. That's a whole nother conversation. But in terms of insurance, yeah, it does get tricky. Sometimes you need a prescription, i.e. like permission from your doctor to see a physical therapist. Sometimes your insurance won't approve it, and maybe you finally get to the therapist and they might not be good. That'll be a separate video of how to choose the right PT for you. But in general, I hope that you understand, bare minimum, that physical therapists are doctors and a valuable asset to your healthcare team. Whatever you need to recover, move better, feel better, there's a physical therapist for that. That's it. That's all I have to say. Later, guys.